Hi, this is Dr. Sam Spiron, a plastic surgeon in the Chicago area. Today we're going to talk about the difference between male and female facelifts. Is there a difference? Why, yes, there's a dramatic difference. Thank you for asking. Men overall, if you look at our society's data, account for about 15% of the facelift patients. You might not know this, but there's been a 30% jump in male plastic surgery since 2000. If you're considering a facelift, you have to talk to your surgeon about what you're looking for to make sure that your expectations match what realistic results they can give you and to make sure your expectations are healthy. So let's talk about some of the differences between male and female facelifts. Probably the single biggest difference is men have facial hair and their skin and muscle thickness and bone density is different. The first means that men are at a higher risk for hematoma because of their beard hair and it bleeds more easily. And the second is we also have to be more sensitive to balding men with regards to scar placement. The second point I wanted to make was that they have different anatomical flap considerations because of the different amount and varying degree of bone thickness and muscle and skin thickness. Now, I think most people would agree that men and women look a tad different. Overall, the female face tends to be thinner. Men also have more fibrous fat, thicker skin, and denser bone structure. These are important differences. A lot of the current facelift techniques are designed to feminize the face. That might not be right for you. If you create too round or too full of a cheek, you can feminize the face. So you have to be very careful. Everyone's goals can be very different, and some people want to feminize or masculinize the face. And that's okay. But you have to make sure to talk to your board-certified plastic surgeon about it. Make sure you're clear with your expectations. In general, women tend to want to restore a softer, oval shape, and they usually focus on elevating their mid-face and cheeks and their brows to highlight their eyes. That's usually their biggest concern. Men, on the other hand, are more focused on their jowls and they want to create a strong and more chiseled jawline. So when you're tightening a man's neck, you can be a little more aggressive about how much fat you're taking out. You don't have to worry about exposing the Adam's apple like you do in women, that it might get too emphasized and they might not like how that looks. Another final important point is in men, a facelift can shift the beard growth. Most men have a non-hair bearing area in front of the ear, which gets lost with a facelift. Women don't really mind too much because they don't have this problem, but men will end up shaving closer to their ear and right up to their tragus. Laser hair removal can help them to recreate a more natural appearance, but again, this is something you have to talk to patients about. So to summarize, please talk to your board-certified plastic surgeon. Tell them exactly what you're looking for. We can change almost any feature, but we have to make sure that patients are realistic and we have to make sure they're good candidates for any procedure. And don't forget, earlier intervention turns back the clock sooner, and that's always a good thing. I hope you guys have a great day. I hope you enjoyed this video. And if you do, please like and subscribe below. Have a wonderful day.